Welcome to Ouch. Was that a ghost? This podcast may contain graphic material, which some listeners may find disturbing. Listener discretion is advised.
Help me.
Now that we covered that, here's your host, Liz.
Welcome back to Ouch Was That a Ghost? Sorry if my voice sounds a little off. I've been sick all week. Today I am covering the case of Gloria Ramirez, or as the media dubbed her, the Toxic Woman or the Toxic Lady. Gaining this name when Gloria went to a hospital to be treated and over 20 medical staff got sick, with symptoms ranging from nausea to being paralyzed to losing bone density after encountering Gloria. Her case is still considered a medical mystery. On Saturday, February 19th, 1994, 31-year-old Gloria Ramirez, who was the mother of 2 young children, and 6 weeks prior had been diagnosed with terminal late-stage cervical cancer. She spent the day feeling nauseous, vomiting, and she just seemed to be getting worse, with labored breathing. It got so bad that around 8 p.m., her boyfriend called 911. Paramedics arrived not long after, and Gloria was rushed by ambulance to the hospital. While being treated on the way to the hospital, she was given oxygen. At about 8:15 p.m., the ambulance with Gloria arrived at Riverside General Hospital. She was taken right into the emergency room. They described her as being very confused, and she was brought right into a trauma room to be assessed and treated. The distressed Gloria was having difficulty breathing. She had an irregular heartbeat, suffering from tachycardia with very low blood pressure. The medical staff switched the breathing assistants from the ambulances to the hospital's oxygen. A respiratory therapist named Maureen Welch said that Gloria's age, even with her diagnosis of cervical cancer, was odd since most patients exhibiting her symptoms were elderly. They medicated Gloria using various medications, which were standard protocol medications, trying to sedate and address her abnormal heart rate. But Gloria's heart rate was still dangerously erratic. She was just getting worse, and she appeared to be going into shock. So the next step was to use the defibrillator on Gloria. They exposed her chest to attach the pads. This was when the first odd thing was noticed. A few of the staff noticed that Gloria's skin was coated in this glossy, oily substance, which they described as oily film. The second odd thing was that the nurses in the room described an odd, fruity garlic smell that they thought was coming from Gloria's mouth. Gloria was shocked by the defibrillator, and an IV tube was inserted into Gloria's arm. Then Nurse Susan Kane began to draw blood from Gloria's arm, and as the blood was being drawn, the third strange thing happened. When Nurse Susan Kane described the blood as having an ammonia-like smell, once the blood was drawn, the sample was handed to a medical resident named Julie Gorczynski. She, along with Dr. Umberto Ochoa, noticed these little crystal-like particles floating in Gloria's blood sample, something that they had never seen before. After that, things took a quick downhill turn in the room. Shortly after, the nurse that had drawn the blood, Nurse Susan Kane, just passed out. Thankfully, a doctor acted quickly and caught her. Nurse Susan said that her face felt like it was burning and was removed from the room on a stretcher to be treated and allow the medical staff to continue and treat Gloria Ramirez. The medical resident, Julie Gorczynski, the one that the vial of blood was handed to, she put the vial down and said that she felt lightheaded. Then she passed out too. When she came to, she was suffering from apnea, which is when your breathing stops in increments, and she was receiving breathing assistance. She too was taken away to be treated. Back in Gloria's room, another medical staff member, Maureen Welch, who was a respiratory therapist, also passed out, who later said when she came to that she could not control her limbs. Several other staff members passed out or said they felt sick, and more of the ER staff complained of various symptoms. The hospital had all the emergency room patients and staff evacuated and relocated to the parking lot, with the exception of a skeleton crew that would stay and work on Gloria, hoping to contain the spread of whatever was going on. The small staff did stay and treat Gloria, who went into cardiac distress. They had to administer multiple life-saving measures. Sadly, try as they may, Gloria passed away that night at 8:50 p.m. about 35 minutes after arriving at the emergency room. She was pronounced dead from kidney failure as a result of her cancer. To try and contain whatever was happening, Gloria's body was moved into an isolation room by 2 of the hospital staff. One of the staff that moved Gloria was named Nurse Sally Balder, who started vomiting and felt like her skin was burning, was experiencing all kinds of problems breathing, and she ended up being hospitalized. In total, 23 of the staff in the emergency room showed at least one symptom that night, and 5 of the affected hospital employees required hospitalization, with the severest case being one of the staff members, medical resident Julie Gorczynski, who was in the ICU for 2 weeks. She was having breathing problems. She ended up developing hepatitis, pancreatitis, and avascular necrosis, which is when bone tissue starts to die from not getting enough blood. This led to her knees losing bone tissue and having to use crutches for months. Gloria, who had been moved to the isolation room, was later wrapped in plastic, then placed in a sealed, airtight casket to try and contain whatever was happening. Staff were treated in the parking lot. Their clothes were removed in case it was a substance or chemical that got on their clothing. Like I said, Gloria passed away at about 8:50 p.m., and by 11 p.m., a hazmat team arrived at the hospital. They searched for hazardous gases, leaking chemicals. No hazardous leaks or spills that would explain what happened were found. After a week, 6 days later, an autopsy was performed in a specially sealed room that was made by the coroner's office, where the staff wore full hazmat gear. Samples were taken, and Gloria was resealed. After the autopsy was performed, everyone that came in contact with Gloria was decontaminated, hosed down. My mind goes to Monsters, Inc. The results showed nothing out of the ordinary, with her cause of death being ruled cardiac dysrhythmia due to liver failure, so heart complications because of her liver failing. Her toxicology report showed Tylenol, codeine for pain, lidocaine, also for pain, and Tigan, which is an anti-nausea medication, with an elevated dimethyl sulfone, which is an industrial solvent, but it's also naturally produced in humans from amino acids that contain sulfur. This is usually broken down by the liver and out of the body within a few days, so it's never normally high. But even days later, when the autopsy was performed on Gloria, she still had a large concentration of it in her system. When this breaks down, it does emit a pneumonia-like smell. The Riverside coroner's office revealed via press conference that Gloria had died of cardiac dysrhythmia as a result of kidney failure due to her cervical cancer, and that they had exhausted all external toxicology studies and have not found any external toxins that would have made the medical staff sick, or that would have been a factor in Gloria's death. Case closed. But Gloria's story hit the media and it spread like wildfire. Everybody had their theories. Even though it was officially closed, the county's health department called in California's Department of Health and Human Services to take a look. An investigation was opened, and 2 top scientists led the investigation. They spoke to the 34 hospital staff that worked the night Gloria came in. They found that 27 out of the 37 staff working in the ER that night were affected, and they found that most of the affected had come in contact with Gloria within a few feet and or had handled her IV lines, and that they were mostly females and mostly those who had not eaten dinner that night. These being affected with an array of symptoms like nausea, shortness of breath, loss of consciousness, muscle spasms. And all those affected staff had blood tests. The blood tests came back normal. With the autopsy results, the blood tests of those affected, and the ambulance staff that brought Gloria in not getting affected at all, and the hazmat analysis, the investigation yielded the finding that this was a case of mass hysteria, and that they were possibly all triggered by the odd odor. But all those affected did not agree with these findings. I mean, look at all the staff went through. Other affected staff were like, no, that's not what happened. Julie Gorczynski being the most vocal critic of the findings. She was very clear that mass hysteria did not cause her to lose consciousness, and she pointed to her previously problem-free medical history. And after handling Gloria's blood, she developed health issues, including spending 2 weeks in the ICU with breathing issues, later developing hepatitis, the avascular necrosis in her knee. This all happening shortly after coming in contact with Gloria. Gloria's family, on the other hand, blamed it on something at the hospital, who had strange incidents in the past of chemical or gas poisons. In 1991, a few employees were exposed to poisonous gas, and in 1993, sewer gas was found in the hospital. This report got the media going again, with the multiple staff rejecting the findings of it being mass hysteria. Julie Gorchowski ended up filing a lawsuit against Riverside General Hospital, the coroner, as well as others for $6 million. Her lawyer told the New York Times that, quote, "These are all professional emergency room workers. They don't become hysterical because of a heart attack." And then an outside agency, Lawrence Livermore Academy, was called in to take another look at the whole case. The Livermore Labs proposed a theory to the Riverside Coroner's Office that Gloria, who was terminal with cancer and in pain, may have tried a home remedy and self-administered something called DMSO, or dimethyl sulfoxide, for pain relief. A chemist on the case was familiar with DMSO, as he himself in the past had used it when he was an athlete. DMSO at the time was sold at hardware stores as an industrial cleaner or degreaser, but it had also been used as a home remedy. I'm not endorsing it, just saying it had been used as a home remedy for muscle and joint pain. Research into DMSO was being done in the 60s, and it showed that it helped with pain, anxiety, an array of issues. But it was stopped by the FDA in 1965 when it showed that during animal testing that prolonged use can affect the lens of the eye. The FDA later approved a watered-down version, like at 50% versus the almost 100% it was originally, as treatment for interstitial cystitis, which is a condition with painful urinary tract lesions. But at the time, you could still find the almost 100% form at a hardware store, which was used for cleaning. Don't do it. It's dangerous. Do not put chemicals that are not prescribed to you on your body. Don't medicate yourself. That Gloria tried this is a theory, maybe trying to ease her pain. DMSO is described as having a strong garlicky smell and is sold in gel form. If you remember when Gloria first went into the hospital, that oily substance on her body and the odd fruity garlic smell. And I'm sorry about this. This is a difficult one to get through. We're about to nerd out a little bit. I'm trying to make it as simple as possible because I barely understand it. So the scientists at Livermore theorized that the DMSO, dimethyl sulfoxide, in Gloria Ramirez's system might have been building up in her blood, whether she used it herself or somehow it got in there. And this ended up causing a urinary blockage because of using it, which led to kidney failure. The chemicals that were building up in her kidney weren't being released, like she wasn't peeing it out, so it was just sitting there. So DMSO, and then she was given oxygen by the paramedics in the ambulance ride. So oxygen plus DMSO could form DMSO2, dimethyl sulfone, which is known to crystallize at room temperature, like the crystal pieces the nurse noticed. So if she did use DMSO and it converted to DMSO2, in order for it to become very dangerous, it needs 2 more oxygens to attach. But also, sulfate has to break both methyl bonds, allowing a space for those 2 oxygens to reconnect. And it could reform to make dimethyl sulfate. But to accomplish this would take a lot of energy. One of the chemists proposed that DMSO was energized enough to break apart and rebond by the defibrillator shock. That may have been enough charge to make the chemical change. So with this theory at the hospital, the shocks administered during defibrillation could have converted the DMSO2 into DMSO4, or dimethyl sulfate, which is a highly toxic dimethyl ester of sulfuric acid. Dimethyl sulfate, or I'll just call it DMSO4, even though some people just call it DMS. DMSO4 is basically a nerve gas. It kills cells in exposed tissues. It can cause delirium, paralysis, coma, can damage kidney, heart, liver, and in extreme cases can cause death. This gas has been tested for warfare, never used, but tested, so they were able to obtain some research on it. Studies from a Department of Defense document, a classified one that somehow they got their hands on, reported that a 10-minute exposure to 0.5 gram in a cubic meter can kill a person. Exposure to this mimics the symptoms the emergency staff reported having. And when Gloria's blood was drawn at the hospital, the cooler outside temperature, like in her body, it was held at, roughly 98.6 versus the room temperature, which would probably be at least 20 degrees lower. It slowed down the breakdown of the dimethyl sulfate. It suggested that the vacutainer's vacuum caused the transition to a gaseous state. A vacutainer being the tube where blood is collected. So if you see blood being drawn, that pole that it has, that basically syringe is like a vacutainer. Or like if you're giving your kids medicine and you're sucking it up and then pushing it out. And that when the blood was drawn, an appreciable amount of it built up in the syringe and some of it vaporized out. This may have been the poison that affected the staff. Some chemists criticize this theory while some agree. And they found that 19 out of the 20 symptoms reported by the staff the night Gloria went into the emergency room were all on the list of reported symptoms of dimethyl sulfate. But this chemical isn't very stable. So when it was in her blood, the unstable compound broke back down into its hydrocarbon and sulfate components, hence the no strange findings in her blood test. The case has been extensively studied, looking for potential causes to what happened in the emergency room that night. Gloria's family was adamant that she did not use DMSO, but devil's advocate, if she did, it wouldn't be that uncommon because home remedies are pretty common for cancer patients. Obviously, this has not been tested. It's just theorized, but some scientists agree it's possible, and like I said, some dismiss it. If it did happen this way, when Nurse Kane drew the blood, some of that poison gas vaporized. It would have been enough poisonous gas in the trauma room that day to affect people, and then it would have just broken down and the evidence disappeared. The Riverside Coroner's Office read the theory and decided that DMSO use was the most probable, and this was told to the public, even though Livermore said it was just a theory, and they can't replicate what happened to see if it would play out the same way, and they don't know for certain if she ever did use DMSO. Again, it was just a theory put forward, but it's still debated to this day, and Gloria's family maintains she did not use it. Gloria's sister Maggie questioned how it took 10 weeks to be deemed natural causes and went on to say that her sister would not have died that night if she had not gone into the hospital. 2 whole months after Gloria's death, her body was finally released for burial or independent autopsy, which the family did. Gloria's family hired Dr. Richard Fukumoto to perform an autopsy on Gloria. This didn't really lead to anything conclusive because he was unable to examine the body because by now she was heavily decomposed and some of her organs were covered in fecal matter, and oddly, Gloria's heart was missing. He couldn't even look at the syringe because that vial of blood was misplaced or missing. The family felt more and more like the hospital screwed up and was trying to hide it, just strange occurrences around Gloria's death, including that one of the lead investigators from the coroner's office from the very beginning did end up committing suicide a month after starting Gloria's investigation. Gloria was finally laid to rest on April 20th, 1994 at the Olivewood Memorial Park in Riverside, California. I just realized this is another California case. What is up with me? She was laid to rest 10 weeks after her passing, with her cause of death officially being cardiac dysrhythmia, that in turn resulted in kidney failure, all brought on from the cervical cancer. Gloria's family continued to blame the hospital for her death, and they weren't shy about sharing how they felt about the hospital and the coroner not being transparent, thinking that they may be trying to cover some sort of malfeasance, the syringe going missing, them taking so long, the organs going missing, and they implied that the hospital portrayed Gloria as a toxic monster to try to cover their culpability in Gloria's death. They went as far as filing a wrongful death and malpractice lawsuit. People still speculate to this day what really happened. Some say it was mass hysteria, or that strange chemical reaction that made basically a nerve gas. Some say aliens. Some say it was a hospital cover-up, just to name a few of the theories. It's just a very bizarre case. And a very sad one, 2 young children left without a mother. And I'd love to hear what you guys think happened. I'm sorry for my voice again today. I'm still feeling like junk. Well, thank you everybody so much for listening. Till next time. Bye.
Thank you for listening. If you need more content or just want to help support the podcast, head on over to patreon.com and search Ouch, Was That a Ghost? If you need some snazzy merch, you can find it at crowdmade.com by searching Ouch, Was That a Ghost? If you have a story you'd like to share, you can email it to ouchwasthataghost@yahoo.com. You can also find us on Facebook and all the other social media platforms under Ouch, Was That a Ghost?
Help me.
All links can also be found on ouchwasthataghost.com.